Okay, we can have this periosteal bone pain in the forearm. Having the radius, the ulna, radius, maybe the distal part almost into the wrist, maybe mid-bone, maybe the relationship between the radius and the ulna itself, or maybe up and towards the elbow joint or the ulnar radial joint at near the elbow here. A conditioner similar to tendinous elbow we were talking about before. I'm going to show you procedures where we stretch the tendons and try and get the blood into the nerves around there. But perhaps the problem in the tendon is more where the tendon goes into the bone, so we have to actually flex the bone. So we're going to do some of these. I'm going to show a couple of procedures for the forearm right now. The procedure would be kind of created around where the pain was, where the patient experiences the pain, how we reproduce the symptoms during the procedure, and of course how they respond. I can't tell that the periosteum or the patient needs any of these procedures unless they have a complaint to begin with. So they have to say, my arm's sore. Well, where's the arm sore? What it's from? And so my work from A to Z is pretty well depending on how the patient communicates to me. So let's suppose you have pain in the extensor tendon here. Comfortable? Mm-hmm. Okay. Mm-hmm. The amount of padding, again, is determined by the patient's comfort. Can I go a little more? Mm-hmm. I'm going to grab her forearm, and we're going to flex that. So, pressure on, pressure off. Feel that bone flexing? Yep. Where do you feel that?
It's right in there.
She feels it. She feels it here. So if I want to change the position until I reproduce the pain that she has. Because she feels a stretch here and not in the extensor tendon where I want it, I'll have to change it around a bit. So I'm going to rotate her arm a bit more and pull her more to the side now.
Yep.
Feel it more there?
All over there.
I can't tell that's the spot. She's the one that tells me that's the spot. So pressure on, pressure off. Pressure on, pressure off. Likewise. Ulnar aspect. Ulnar aspect. Pressure on, pressure off. Pressure on, pressure off. Be easier to see if the blanket's not there. Suppose we want to just go backwards a little bit. I'm pretending the blanket's on there. This would be more closer to the wrist. Can you go a little tight, or is that too tight for you? Well, we pretend it's okay. We'd have a blanket on there, though. So then I'm flexing the bone. See? Flexing more close to the joint, more close to the wrist joint. And I can bias it this way, or I can bias it that way. Or just turn your arm. This way. This way. Or this way. This is true for all the bones. Slide down a little more. This way, or that way.